Everybody, guess what? It's Tuesday and we have a special guest today. We're here to talk about Vita Nova's grand opening. I have Dr. Mehta here with us to talk about that. How's it going today?
Doing well, doing really good.
So you got a big event coming up there.
Yeah, we sure do. We got a big event tomorrow, our grand opening, getting our clinic going. We have a ribbon cutting at 11:30, and very excited about it all.
I like the name of your clinic there, Vita Nova, which kind of means new life. So tell me about that because you have a way of offering people kind of a new life.
Right. Yeah, Vita Nova is Latin, obviously, for new life, and that's our goal here is try to get patients to wake up to new health, to better health. You know, a lot of patients are suffering from chronic pain conditions. It affects their functionality. It affects several different things, the way they move, their jobs. It can even affect a person's personality. So we're hoping to be able to control that pain, get them to their tissue to work better, to have them function better, and basically renew their life.
Yeah, talk to me a little bit more about how that works. It sounds a little scary. I got to be honest, as someone who's not had that time, when I read about it, it sounds a little scary, but help me understand it better.
Sure, sure. We use regenerative medicine. Regenerative medicine is kind of a new field of medicine, I guess you can say. And medicine is constantly evolving. You know, we've gone from bloodletting to brain surgery, and regenerative medicine is basically along the lines of the next kind of phase in medicine, I feel. It's something that we use. We use products from your own body, like stem cells, PRP, platelet-rich plasma, or something called exosomes. And all those materials have regenerative properties to help kind of rebuild tissue, to help control inflammation, modulate inflammation, and reduce pain. And by helping rebuild the tissue, what happens is the person is able to function better, you're able to move better. Patients who've had osteoarthritis of the knees, for example, they can move their knees better. It helps with tendons. It helps with back, neck pain issues. There's several different conditions that can be treated with regenerative medicine.
Yeah, that I noticed that when I was checking out your website, you do have a lot of areas that you treat. What would you say is the most common thing that you treat?
The most common thing we treat is musculoskeletal conditions, like spine pain, neck pain, back pain, joint pains like knee pains, elbow, shoulder pains, uh, different tendinopathies and ligament issues. Those are the most common things we've treated. We've also treated certain neurological conditions as well. One of the interesting things is we've seen benefits in patients with autism, for example, where we see improvements in symptoms of autism with using stem cell therapies.
Wow. Wow. I mean, that's pretty amazing. Talk me
Yeah,
through the
yeah,
actual process of what happens when we come to your office when we decide to try this.
sure. Sure. The first thing we do is we have a free consultation. So we will examine you, we'll look at your medical records, look at your particular condition that you're coming to us for treatment for. Um, and then after evaluating you, looking at your x-rays and MRIs, determine a good path of treatment for you, whether it be using PRP or stem cells, or even there may be even cases where we feel like the stem cells may not help you. And there are those cases, unfortunately. So we would inform you of that as well if we feel that it's going to benefit you or if it's not going to benefit you. Uh, Once we determine a treatment plan for you, uh, when you do something like we would set up a date for you would come in to get your stem cell therapies. On that date, if you were doing a stem cell therapy with us, we can get stem cells from three different places. You can get them from bone marrow from a person, or you can get them from adipose tissue, which is the fat tissue. So we would do like a mild lipo aspiration or liposuction. Um, and just a minimal liposuction. It wouldn't be too much fat that we would take. I know some people want more taken out than others, but
I'm like, sign
but
me up already. I don't know what you're doing. So
And then the stem cells we get from the fat would go to our lab, which would process the fat properly and extract the stem cells out of there. We have the ability to also grow those stem cells. So if we need larger numbers, we can grow them to large numbers, or whatever number is suitable for that patient's particular condition. Then we can store those stem cells and regrow them later if we need to, if there's another part of the body that needs to be treated.
Hmm.
With the bone marrow, we would aspirate the bone marrow that day. It would be processed in our lab, and we can use the stem cells almost immediately from the bone marrow. And then that would be injected in certain areas of the body that are needed. We would also combine it. So a lot of times we use PRP along with the bone marrow. PRP tends to work, as I say, as like a fertilizer for those stem cells to work better.
Wow. Wow. That's been fascinating to
Yeah.
learn more about that. So when we come to the grand opening, will you guys have more information where people can learn about that?
Oh, yes, yes. We'll have a lot of information there regarding PRP, bone marrow stem cell treatments. We'll have information regarding other treatments that we offer. Some of the other things that we offer are red light therapy. We do have a medical grade red light bed that we can use to help enhance treatments here. We also offer peptide therapies. Peptides can also enhance the stem cells and other conditions. So there are several options here that we have, and we'll be able to go over all of that with you when you come in for the grand opening.
All right, we'll put that information in there. It's happening Thursday, February 26th. You're located in Franklin, 11 o'clock. Hey, thanks so much for talking to us.
Oh, you're very welcome. Thank you for having me on. I appreciate it.